I didn't want my life to end. You know, I was 17. That's not your life when you're born, you're 17. It's a fun part of your life, it's chapters, but you know, once you graduate, you're in the world. I was very sick. I was on oxygen 24/7. When I heard them say, 6 months, at 17, I broke down crying in an instant. They said you have to be strong. So I had to suck up the tears, and if I knew that would save my life.
Nicole was our first child, definitely a due date baby, so everything went as planned. And all of a sudden, the doctors noticed something was wrong, because they had to do an emergency surgery. And that's when they removed 31 centers of her intestine. And from there on, it's just been a struggle.
Hi, Nicole. Happy birthday.
We found out she had cystic fibrosis at 3 years old. Nicole was always very sick, always to the pediatrician every week. I've always said, I live with the heartache, she lives with the disease, and it's a terrible disease.
About 1 in 2,500 Caucasian children will have cystic fibrosis. There's a defect in a gene that kind of regulates the composition of mucus and secretions, and because of that defect, a lot of the organ systems that involve mucus production or glands can be affected, and especially the lungs. Survival of kids with CF has gone from 20 years to 25 years to 30 years to it's about 37 now if you're born today.
CF is basically drowning from the inside. So my lungs would be filled with mucus, and then it'd be my esophagus, so trying to catch a breath, I'd be like, ever since I was little, all I wanted to do was sing. I wanted to be the biggest pop star. You want to hit that note, you want to, sing a song so perfectly. And with my old lungs, it wouldn't ever be perfect because the air wouldn't be able to come all the way through.
Then it hit suddenly. It really did. 16 came, and like overnight, she was like, I just can't breathe anymore. We found a new doctor in Miami, and he took one look at her, didn't even have to examine her. He goes, she has less than a year. And he says, you better find a place to have a lung transplant. We looked at Miami. They weren't willing to take her on. I had a dear friend who had a double lung transplant at Duke, and he says, you're going to want to be at Duke.
Duke is one of the largest lung transplant programs in the world.
Well, we've done over 1,000 lung transplants here at Duke now. These 1,000 lung transplants would not be possible without the involvement of every team member at Duke Hospital.
Hello. Dr. Palmer, it's nice to meet you. When I first met Nicole, I remember her as a thin, frail, young girl with CF. She came to me in a wheelchair. It was really clear she was quite debilitated and had a very, very limited expected survival.
I got, pulled, mentally towards Duke, thinking that, hey, this is going to be the place that can save my life. And once I got there, it felt like so, warm and so comforting.
She was evaluated, deemed to be suitable for as a transplant candidate, enlisted, and not too long after that, we received a phone call about a donor that might be a suitable match for her.
Our median wait for lung transplant today is about 11 days. It's incredibly short, and that reflects how aggressive we are in terms of the organ procurement. It also reflects the fact that we're transplanting a lot of really, really sick people.
And we're sitting there 8 o'clock in the morning, Monday morning.
Phone rings. It's Duke.
You need to come to the hospital now. We have lungs for you.
And I'm like, no way, is this a test run? Are you joking? It's like, no, Denise, get a grip.
We rush to the hospital like no one's business.
We'll send someone down, one of our team members, usually one of our surgical fellows, to go look at the lungs.
And if we think that the organs are good, then we would make a go call.
And then we'll take those lungs. There's a preservation solution and a coolant, and someone will fly back with those organs, and another team will get started in the operating room.
They took her in about 11:45 on February 25th.
They had wheeled me out into the hallway before we got in the operating room. And I was hugging my parents. And I remember when I hugged them, I had like this ninja kung fu grip, and I wouldn't let go. Like, they had to like pry my arms out from around my parents.
I remember saying to her, and you come back to me. This is not it, you know, you'll be back. And then she just took off waving like, oh, God. And yeah, that was the hardest day of my life.
So I said to myself, let go. And once those doors closed in the hallway, it was like everything changed. In that second, everything changed. My whole persona changed completely. After crying and everything, I stopped. And I was like, took a deep breath. I'm like, this is happening. You have to do this. I remember being in the operating room, seeing all the lights, and I asked them, please not put me out until I see the doctor or whoever is doing my procedure.
They had told me that she did not want to undergo anesthesia until she saw me and talked to me. So I went up to her and she asked me if I was okay.
And I said, it's midnight. Are you tired? Did you have some coffee? You want to go take a bite to eat first?
It's kind of ironic because, you know, she's the patient and I'm the doctor, and she's asking me if I was okay.
He was. I'm ready. Let's go. And then that was it. The anesthesiologist put the mask on me, so I count back from 100. I think I got through like 98 and a half, and I was out.
Tonight we have Nicole Graziano. Blood type is O positive. We're here for a bilateral lung transplant.
Whenever we do a transplant like this, time is of the essence.
If all goes well, we've timed it perfectly. The organs arrive and we're ready to take out the old lungs and sew in the new lungs.
In her case, we took out the left lung first, while the right lung, although as sick as it is, it's supporting her life at the time. Right around that time, the organ would arrive.
Dr. Lynn, lungs are here. Great. We have UNOS number A469.
And we would implant the left lung first.
Derek, we're ready for the left lung.
Left lung coming, sir.
And then we would work on the other side, which is the right side for her. The moment that we all get really excited about is when we unclamp the blood vessel and see the lung pinks up and see the blood flowing through the lung, performing its function, which is to absorb the oxygen and get rid of the carbon dioxide in the blood. And when that happens, we know that we've really helped her out.
It was the longest 13 hours of my life. But they called, they gave us updates. We have one lung in. Wow, they have one lung in. Okay, hang up and wait again. Both lungs are in. Oh my God, they called us. 2 lungs are in.
Nicole's operation went really smoothly.
I remember waking up in the ICU. I had so much IVs and tubes inside of me. But I went in the operating room with oxygen and came out with no oxygen on. I don't know if pure is the right word, but I felt different and new after I took the tube out, and I was like, oh my gosh, I can breathe like a normal person.
What can I say about Duke? I'll start bawling and crying. They're just amazing. Every aspect, all my expectations were totally met and beyond.
What I think about, you know, my time spent on 7800 and the nurses, I respect every single one of them, but the 2 that really stick out is Brittany and BJ. And they just sit there and talk to me and just take my mind completely off the procedure that's happening.
That's what nursing is, making your patients feel like, you know what, I'm not a patient, I'm a person. I treat my patients like I treat my family.
That special one-on-one time attention is what I think makes the difference of being a Duke nurse and being a 7800 nurse. We are a family up here, and I think that's what makes us tick. We have the most unbelievable teamwork. Family supports one another, and we're supporting her along her way and cheering her right along.
Transplant carries with it a lot of risk. I just want to see Nicole continue to do well.
I trust them with my life because, you know, they helped me get it back. So I had to say, you know, I owe the health of my, you know, me to them. This is definitely a new lease on life for me. And I respect, you know, my donor family, and I respect these lungs in my body. My singing is most important.
No more pain, no more strain.
These lungs are helping me do what I've always wanted to do. And now I can do it 1,000 times better than I ever could. I'm studying musical theater, hoping to get my BFA. And hearing that, you know, you have 1 year to live, you have 6 months to live. It's like, but this is what I want to do in my life. I want to be on Broadway.
I dreamed that love would never die.
longer I live, the bigger the goal is going to get and the closer it's going to get.
When Nicole sings, a moment that we are very proud of because all of us have contributed to the way she sings right now, which is beautifully. She is basically representing us.
I wouldn't have my voice without these people.
I had a dream my life would be.
So every time I sing, in the back of my mind, you're here because of them.